Welcome to Meet the Experts AYA edition. Today's topic is all about Moffitt's Adolescent and Young Adult program with our expert, Stephanie Avakian, AYA Program Administrator at Moffitt. Meet the Experts is brought to you by Moffitt Cancer Center's Patient Library and Welcome Center. Please visit moffitt.org/meet the experts to see our upcoming sessions. The content in this presentation is not intended to be medical advice, and the viewers should consult their physician should they have any medical questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. And if you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional advice or delay seeking care because you watched this presentation.
What is AYA? Some people hear that acronym and not sure what that really encompasses, but it's a broad spectrum of adolescents and young adults ranging in age from 15 to 39. With this, there's about 84,000 new cancers around this age group every year. And as you can see with the little chart right here too, common cancers really span. And we'll see a little bit more in the next slide as well, too. So what makes this population so unique in terms of cancer care is that many of these patients are delayed in getting their diagnoses. For many reasons, people don't think that patients this age would get cancer. They'll go to their doctor and they'll say, oh, you're okay. It's nothing to worry about. So many times patients come with advanced cancers by the time they come to Moffitt. Many of these patients are underinsured or have no insurance. They might be students. And that's another thing is that do they have to quit school? How do you continue school? And then transitioning from independence to dependence. Some people have to move back in with family or quit school and move back in with loved ones and such. There's also issues involving dating and sexuality. How do you tell a new partner that you have cancer, that you just recently started dating? How do you even go out in the dating pool and find somebody knowing that you have this and feeling ambivalent possibly about sharing your diagnosis? Many of these patients, like I mentioned, are students or they're very young professionals or with young families. This creates financial toxicity. Many people have to stop work, take breaks or FMLA from work. And as research has shown over time, most of these AYAs end up earning less over their lifetime due to loss of benefits, loss of income, and loss of retirement growth as well. Fertility and preservation and infertility issues are huge in this age range. Having to start treatment oftentimes can put fertility at jeopardy, as well as trying to find the money to get fertility preservation sources. Clinical trial eligibility is extremely low as well, and there is a big component of survivorship. 86% of all cancer types combined go on for survivorship. And then these AYA patients, because of the harsh treatments that they may have received, oftentimes can develop secondary or tertiary cancers later on in life, as well as cardiac issues. Moffitt's AYA program has been growing over time since about 2011. You can see we are on this path of growth. Every year we try to do more and more here. We recently reopened the lounge on the fourth floor last summer as it had been sort of closed down due to COVID. And we're also disseminating more fertility information and posters and we'll talk about this a little more later about our fertility grants that we do offer. But we're trying to increase patient events. AYA is all about getting patients connected and with each other and with a program of support. We're also working on some fertility plans in Cerner, like a smart alert that will alert providers if a patient is under 40 to discuss fertility, as well as creating power plans in our electronic health program as well. Especially right now, we're focusing on males to where that process can become smooth and providers can do referrals in real time. And we're hoping to increase our support from Foundation. We're completely supported through donations here at Moffitt. This is some of our last data from our last fiscal year. As you can see in that first graph we saw on the first slide, it shows 55% of other cancers, which end up, a lot of those are in our hematology clinic. Malignant hematology, as well as our bone marrow transplant area, those do see a lot of AYAs followed closely, like from breast, sarcoma, GYN, and some others are starting to catch up, unfortunately. So our growth since fiscal year 2015 shows exponential. Obviously, Florida population is growing, but that also means the AYA population is growing. And so there is a huge need to address the unique needs of these patients. And this is just Moffitt. So our program is multifocal. We really want to address the age-specific, unique medical issues that these patients face, their educational needs, their psychosocial needs, as well as bringing up reproductive issues, having research being a huge component of what we do, as well as bringing forward visibility and getting more and more people, both internally at Moffitt and externally, knowing more about the AYA population. It's a global movement. It's not just Moffitt, but this is what we do. Our program goals are sort of in a circle. All of these are important. There's not a pyramid at all. We really care about education, trying to get patients the education materials that are appropriate for their age and for their families. Obviously, we talk a lot about fertility because that is a huge, huge topic in the AYA population, making sure they know about the risks of treatment as well as the resources available to them. We do have a nurse navigator who does help with any cares that the patients might have on a clinical side, psychosocial as well, trying to intervene and advocate for patients. Research, we do provide research grants to Moffitt researchers as well to forward research. And we do a lot of social events as well to try to create connections because it's so important for these patients to have peer-to-peer interactions because a lot of times I hear the time actually that patients come to Moffitt and they see grandparents. And it's not all about grandparents, obviously, but they don't always see other patients their age. And that's another reason why this program is so important. And then survivorship, promoting health beyond treatment. And as they move past their immediate needs, how to stay healthy ongoing. So our structure is very interesting. We have two co-program leads. Dr. Megan Haas is over our AYA programming, and she's in the supportive care department. And we have Dr. Jonathan Metz, and he is over our AYA research, and he is in the sarcoma department. And then obviously myself, and then we're over the AYA program as a total. One of the great aspects that we have is a nice AYA ambassador group. And those are patients in various stages of their treatment, post-treatment, who are all about wanting to give back and advise on how the program is running, what they want to see happen next, and what they feel is important. Their voice is just tantamount to what we do. And so they do meet monthly and help us plan any social events, as well as we recently talked about social media and how to reach other people and share stories. We also have an AYA staff committee, and that's made up of about close to 140 Moffitt team members. They come from various departments within Moffitt, but just wanting to know a little bit more about what we do. And we meet quarterly with the staff committee. Underneath that, our subcommittees consist of AYA specialty nurses. We have about 15 of those right now, and those are special nurses who have decided to learn more on AYA on their own and also as part of their clinical ladder for promotion. But they act as the specialist in their department or floor area to promote AYA with their patients and with other staff. We also have a fertility champion, Carol Greenslade. She is also a nurse navigator in our sarcoma department. She is happy to answer any fertility questions anybody may have. Our psychosocial department is chaired by Olivia Loginski, a licensed clinical social worker here at Moffitt. She is also very knowledgeable on AYA issues as well as our fertility grant. Also, we have a research retreat that last year did not occur, but this year we are bringing it forward again, and that is going to be on May 9th here at Moffitt, where different researchers are going to share their studies and their findings with each other, as well as be able to apply for additional grant money that we offer. And then obviously survivorship. This is just another breakdown of what we do and just a different way, a little flow chart flows together, but it all goes back to AYA and our program needs and our mission. So the big thing that a lot of people hear about first about AYA is our programs. We try to be very active. Each month we have a networking social, either at Brio, that is also led with the Leukemia Lymphoma Society, open to all patients 15 to 39 and a guest. Some are also offered here at Moffitt. We do the monthly ambassadors advocacy group that I mentioned earlier. We have a quarterly educational webinar like today, Meet the Experts, where we share timely education that is important to this population. And then coming up, our most exciting event is globally, the first full week of April is always AYA Awareness Week. And we're very excited to be offering a prom the Saturday before, as well as two patient panel webinars, one about parenting with cancer and one about AYAs that are next level. And that term meaning that they're now over 40. And so they're going to share things they wish they had known when they were first diagnosed or things they wish they had known when they were younger to be able to help and share their stories. We also have an annual LGBTQ plus survivor panel that's very well attended by staff and outside patients and caregivers as well. So they can share their story and their experience to improve it. And then we also have AYA lounge nights now. They are once a month over in our lounge. And we're really excited to get people connected, and it's open to patients who are currently admitted to the hospital, as well as patients that just come for their normal appointments can attend. We also did a Friendsgiving. We've done that 2 years in a row now in November, which is very fun. And we always have an annual holiday party. This is extremely special because patients leave with at least one Christmas gift, and this is all by donations. Previous ones that we've seen are right down here. We're always open to ideas from our AYAs to try to make it fun and interesting and get them to get away from cancer for a while and meet each other. Like I mentioned, we're having a prom April 5th. We're very excited over at the USF Marshall Center. And as well, we are having our first annual AYA family picnic this Saturday at Lettuce Lake Park. We also have internal activities, like I mentioned. We have the AYA staff committee meeting. If any of you all attending today are staff and are interested, please feel free to reach out to me with an email and I'd be happy to add you to our list. We have monthly subcommittee meetings for fertility, psychosocial, and the nurse subcommittee meetings, like I mentioned here. And then AYA week for internal activities, there's going to be some sessions about meet your AYA specialty nurse. So people can log in and meet those specialty nurses scattered throughout our campuses, as well as a nursing grand rounds that we are going to be doing that is going to be very interesting, all about AYA, where nurses can get credit as well. Our research retreat, if we do need volunteers, we also ask Generation M, Unity, some of the TMENs, for, which TMEN stands for Team Member Engagement Networks. Sometimes we'll ask them for volunteers as well. And we do road shows to any departments internally at Moffitt that want to know more about AYA programs. This is just a snapshot of some of our partners. It really just adds more all the time. Some of them do fund us in different ways. Teen Cancer America is a huge supporter of Moffitt AYA, as well as AYAs throughout the country, and they provide mentorship and advising. Swim Across America was the key component to getting the lounge created back in 2016. But we also get a lot of money from Martinis for Moffitt. They were very kindly raised a bunch of money. We received $150,000 last summer from that event alone, and we're hoping that it grows and we get even more this year. But Columbia Restaurant has also donated gift certificates to our patients. We also work closely with Stupid Cancer Dear Jack Foundation, and our newest partnership is going to be with Johns Hopkins All Children's Hospital for a pediatric component. So if you were to visit moffitt.org/AYA, this is the website that you would come across. We hope you'll visit. And then as you scroll down on that webpage, you'll learn a little bit more about AYA and our goals as we already went over today. But that little yellow box in the bottom right corner is so important. Anyone is welcome, patients, caregivers, staff, to sign up for our emails. And we do a monthly email. Quarterly, we do a newsletter that goes out about all of our events that also highlight national organization resources as well. These are copies of our wonderful newsletters and emails that we go out. They're colorful, they're fun for interest, and they have links where they go directly to the information that is needed. We always, in a newsletter, highlight an AYA patient story that Moffitt PR and Marketing has put out, which is wonderful. People love to see other people their age and what they're going through. But we also highlight a healthy recipe, like I mentioned, a national support resource as well too, as well as all our Moffitt individual unique events. So this is a packet. It's called the AYA Resource Packet. These are available in both English and Spanish. You can pick them up at the Patient Welcome Library on the second floor, as well as each of the clinics should have these. Feel free to ask your provider for one of these, and they are also located in the patient lounge, the AYA lounge on the fourth floor. This includes Moffitt direct resources as well as some national ones as well. Fertility, this is the big thing that a lot of people ask me about right here. We do have a budding fertility program, and we do offer financial assistance. These funds are based on income, and you are welcome to reach out to AYA, and we are happy to get you partnered with our social work to complete an application. They are up to $850 for males and $2,500 for females, and that's met at 100% full need. But obviously, there are other resources out there to help you raise the money that you need for fertility because it is so important, and there are people that care. These are the 3 fertility institutes in the community that we currently partner with. We don't highlight one over the other. Some people prefer one just based on where they live, but all 3 of them are very used to working with Moffitt patients and make them a priority to meet with a reproductive endocrinologist and then talk about the programs.
Thank you for viewing this session. We offer live Meet the Expert sessions through Zoom. To see a full list of upcoming sessions, please visit moffitt.org/meet the experts or call 813-745-1690.